In this video, I will be addressing two surgical procedures, a meniscus repair and a partial meniscectomy. Both procedures are minimally invasive and are used to address some lesion that has occurred in the meniscus. A meniscus repair is when the lesion is sutured together, whereas the goal of a partial meniscectomy is to remove part of the segment that contains the lesion. First, I'm going to explain the repair, and then I'm going to go into the meniscectomy later in this video. A meniscus tear is the most common reason for a person to undergo a meniscus repair surgery, and it's most commonly a sports-related injury, such as twisting on a planted foot or contact that occurs at the knee, either medially or laterally on a planted lower extremity. The incidence for meniscus tear is 66 per 100,000 knee injuries. Meniscus tears affect men more than women and are more common in younger active populations with a mean age of 25 years. The precautions and contraindications of post-meniscus repair surgery will largely depend on the surgeon and the protocol used. The most traditional surgical approach would be to place a patient on non-weight-bearing status for 6 weeks. However, there has been a recent push for a more conservative approach that allows patients to be partial weight-bearing or weight-bearing as tolerated. The most important thing for you as a physical therapist is to understand the protocol and adjust therapy as appropriate. The exam is going to look something like this for a meniscus repair. If your patient is put on a more restricted post-surgical status, active and resistive movement testing will not be appropriate. But you can assess your patient's passive movement of the knee, and both flexion and extension will likely be limited due to pain and swelling. You also want to assess the position of the patella, which has likely been pulled out of optimal alignment due to tight quads after the surgery. This alignment will be important when we introduce strengthening exercises of the quads. Palpation will reveal swelling and warmth due to inflammation. Neurodynamics are not necessary, and as this is a surgical procedure, you will not need to perform any special tests. Okay, now moving on to the partial meniscectomy. It's most commonly used to address degenerative changes such as with osteoarthritis, and is more common in patients older than 60 years of age. It also affects men more than women. The post-surgical protocol for a partial meniscectomy is largely unrestricted, and therefore you should be able to perform a full exam using the patient's pain as your guide. Both active and passive flexion and extension will likely be limited, again due to pain and swelling. There's no need to address contractile unit testing of the knee, as the musculature was never a source of the injury for this procedure. Again, you want to assess the position of the patella. Palpation will reveal swelling and warmth from the inflammation. Neurodynamics are not necessary, and again, you do not have to perform any special tests. Signs and symptoms that would indicate a referral back to the physician are complications of incision site, such as poor closure, signs of infection, or a suspected DVT.